Here's the one team working for Tuesday the 9th of March. So we've got a micro team update today as a few new products have been introduced recently. So Emily from the delivery team and Justine from the micro team are going to explain a little bit more about these three different products. We've got the JS report emailer, sort requests, and also an update on care plans.
So the JS report emailer, what this is it's something that's looking for a completed form on Zone Standard. Once a form has been completed and saved, Zone Standard can look for those completed forms and embed certain information from those forms into an email. This is great because it's going to reduce the manual sending of information, and also we can look at all the different ways that we can apply this to other things. So for example, meeting minutes, completing minutes on Zone Standard and these automatically being sent out to the attendees. If it makes sense. As soon as she said meeting minutes, I got it a bit more. I was like, okay.
I'm going to talk to you today about a new product that we've launched called Sort. Sort stands for Subject Owners of Referral and Tracking, and it's a way for you to request issues and raise questions through your green eye. From here, they will be triaged to the correct intersources to resolve your request. Another feature of Sort is the Discuss It platform, which is used for you to directly communicate with the intersources who are resolving your request.
So this is really good for staff who don't have emails, who want to raise problems with their rota or their annual leave. It's really going to reduce email traffic, and there's going to be no need to chase information because you're going to be able to track that sort request all the time through your green eye. So an update on the care plan currently. The initial audit, gap analysis and transferring of information to holistic needs has now been completed for 40% of the individuals. We do have now a revised completion date, which is the end of March, so that we can ensure that quality is there that we want in those care plans. And now we have a new approach to the care plans. Staff are going to be getting dedicated time to complete these, and they've also received training so that we can ensure that the care plans are going to be done to the highest quality.
COVID clarification. So Emma is here to clarify exactly what you can and can't do on this first step for the roadmap out of lockdown.
Just an update in relation to some of the COVID rules that the government are introducing. So from the 8th of March, we know that some of the schools have gone back. What we can do in terms of meeting other people, we can only go outdoors either for exercise or recreation, either on our own, with our current household, or with a support bubble, or with one other person. It is essential that we keep 2 meters apart if you meet anybody outside of your household, and yeah, it's just that one other person. We'll keep everybody updated as the rules currently change. Thank you.
And Zoe also reiterates what the return to work process is and how important this is for everyone to follow.
It's really important that before you return to your shift after an absence, you contact the absence line to complete your return to work. The reason that we want you to contact the absence line and why it's so important is to make sure that, one, we've given you that support that you require, your return to work is then completed, and any additional support that may be required is then put into place from as soon as you're put on shift, really. So what's going to happen moving forward is there will be restrictions put on Zone Standard. If you have returned to shift and you haven't contacted the absence line, you will not be able to gain that access back until you have contacted to do that return to work.
George has got a testing update to explain what to look out for in the homes this week with return boxes, and also to highlight the wiki with all the different information on testing.
Just a quick testing update. You may have received some big boxes delivered to each of the homes. These are the test return boxes. So these are what we use at the end of the day once we've done all of our PCR tests to take them with the external couriers all the way back to the labs to be examined. We no longer have to build the individual PCR test kit boxes, which is very exciting. We get a lot of time back now that we don't have to build these boxes anymore. So please just recycle those boxes. You can just use the bags that they come in once the PCR test has been completed to then pop that into the external box and then go with the courier. Don't forget, if you are unsure which homes are testing on which day, please feel free to have a look at the testing schedule wiki. That's accessible to anyone, so if you need testing on a certain date, please have a look at that and let us know. With all of the exciting updates that have come about with testing, we've ensured that all of our wikis are up to date and up to scratch with all the current guidance. So please make sure you have a reread through all of the LFT testing and PCR testing wikis to make sure you're on top of all of the information that you need to carry out your testing. Thanks everyone, bye!
Another part of health and wellbeing, alongside the data, is why it's so important that we do collect this data. And it's all about giving the individuals we support a voice. So here's Hazel to explain a little bit more.
Health data is just so important, not just because we can then pass that on to the consultants and the medical professionals that are looking after our individuals and give them all the information they need to make good decisions about care and treatment. But for those individuals who can't say how they're feeling, it gives them a voice, because all we need to do is look at that data and it tells us how they're feeling in an indirect way. So it is really, really important. Oh, I dread to see the edit.
And Phoebe here asks staff to look out for an email ahead of your upcoming round 2 of vaccinations.
So part of my new role is booking in any outstanding vaccinations. So from this week, staff will be starting to have their second vaccination. So we'll be sending out reminder emails for those staff members. It's really important that the staff members keep hold of the emails that we send, because they'll need these, but they'll need to show them when they go for their second vaccination. Watch out for your emails. Happy vaccinating!
And Arnold Schwarzenegger has had his first vaccine and is urging everyone to do the same. Come with me if you want to live. That's a really poor impression. And then here are some photos of what else has been going on recently. Thanks everyone, see you again next time.